Hey guys, it's your girl AG with nursingforall.com and Hurst Review Services. And today we want to talk to you about learning how to critically think. And I know you're like, oh AG girl, I can't even remember what I ate for lunch today and you want me to critically think? Yes, we want you to critically think because we know that critical thinking is what you need to have to be a safe and competent nurse. Now, here at Hurst Review Services, we know that critical thinking leads to having good judgment. And unfortunately, they don't teach you judgment stuff in any textbooks anywhere. Now guys, I love being an instructor for Hurst Review Services. And when we teach nursing students, we often find that you just want to know what's going to be on a test. Okay guys, learning that way and only wanting to know what's going to be on your test is not going to help you learn how to critically think. And it may even hurt you in the long run. Now, when you just want to know what's going to be on the test, you are limiting your knowledge just to the test. But here at Hurst Review, we know that in order for you to be a competent and safe nurse, you have got to know more than just what your teacher will put on a test for you to pass. Now, critical thinking is kind of difficult, but you've got to learn this way for you to be a safe and competent nurse. And you've got to do more than just memorize information. You must be able to apply your nursing knowledge. You see, on the NCLEX, the answer won't always be black or white. Sometimes you're going to have multiple correct answers available, but only one answer is going to be your best or priority answer. You see, we've got to learn to think this way because we want to be prepared for real-life nursing situations. We've got to make quick decisions about client care. Critical thinking involves multilogical thinking. Now, although you may be studying and learning the body-by-body systems, we're going to be taking care of clients who have multiple disease processes. For example, let's consider the pregnant client who is going into heart failure because of eclampsia. You see, critical thinking takes a little while to improve and to learn how to do, right? So how are we going to do this? Well, number one, we're going to challenge ourselves. We want to go beyond memorization. You see, we want to get that knowledge into our long-term memory. Now, one way to get the knowledge into our long-term memory is by repetition. You see, guys, you can't read something one time and expect that knowledge to go into your long-term memory. It takes time and it takes repetition. You see, this goes beyond memorization. Now, when you only memorize, you're not helping that knowledge go into your long-term memory. And memorization is not going to help you much when you're dealing with real-life situations. Now, another thing we can do is talk it out. You see, when you can say it out loud, you can pass it. You may only want to make an outline with just a few skimpy notes. Now, if you can take this and lecture from it, you're doing pretty good. But if you can't, you need to study some more. We want that information to go into your long-term memory. And another way we can do this is understand the why question. You see, we want to understand the causes behind our disease processes, our signs and symptoms, and even the interventions that we're going to be doing. You see, if you don't understand why the healthcare provider has ordered something, should you just be doing it? No, we don't want to be inferior and incompetent nurses who just go and follow orders. We always need to question and we always need to know why. So start making sure you do that now while you're in nursing school. The more you understand the why, the better. And guys, it's okay if you don't understand why, then ask someone. Now, also you want to find a role model to emulate. Guys, there's plenty of nursing faculty and seasoned nurses who are experts at critical thinking. All right, here's a scenario for us to consider. How does heart failure lead to fluid volume excess? You see, in order to answer this question, you have got to know what is happening when someone goes into heart failure. This is going to require you to answer the why question. You see, when a client goes into heart failure, the heart muscle is weak. And when your heart muscle is weak, it's not pumping effectively, so your cardiac output goes down. Now, when your cardiac output goes down, nothing is getting perfused well, and especially your kidneys. So if your kidney perfusion goes down, your urinary output goes down too. And guys, if you are not putting out all of that fluid volume, where is it staying? In the vascular space, our favorite phrase. Guys, learn how to start critically thinking now while you're still in nursing school. Start with these tips for improving your critical thinking skills so that you can become a safe and competent nurse. All right, guys, that's all we have here for you today at Hurst Review. We hope that you would like, follow, and subscribe to Hurst Review on all of your social media channels. And tune in every Tuesday and Thursday for more NCLEX tips and nursing topics. Peace out, players.